Hello, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about whether or not tick-borne illness patients should donate blood. And the reason I'm reviewing this is because I had a patient ask me this recently. So, by the way, this is Juju. For those of you that don't know her, she is an 11-week-old French bulldog, and we're just teaching her how to be on camera and how to be a really good office dog. As you can see, she's real chill, aren't you? You real chill? Okay, so should Lyme patients donate blood? The short answer is no. And the reason is that blood that's used for transfusion largely is reviewed or assayed by the Red Cross, and they do look for things like HIV in the blood, but they do not routinely look for Lyme, Babesia, or Bartonella. And all three of those are known to be transmitted, known to be in the blood. So why would you assume that it would be okay to transfuse or donate blood from a patient that had any of those tick-borne illnesses? I think that's true for the other ones too, like Tularemia, Ehrlichia, Anaplasma, Rocky Mountain spotted fever, bourbon virus, Heartland virus, any of those, dengue fever, any of those, you probably shouldn't be donating your blood because they really don't test for them. And if you have these infections, essentially your blood is dirty. I mean, dirty in the sense that it has pathogenic organisms in it. So you really don't want to be donating that to somebody who doesn't have Lyme disease. And if they're not checking it, how can you know? Now, some people will argue, well, the spirochetes don't live in the blood. Well, yes, that's mostly true, but probably if you get out of the tissues deep, they live deep within the tissues. Probably if you get out, and if they get out, then they're going to be in the blood. And if they're in the blood, then they can be passed on. And, we're trying to minimize the problem with tick-borne illness, not make it worse. So I would encourage people not to donate blood. And if you are receiving a transfusion, ask the hospital or the doctor if you could please have the blood that you're receiving, if it's from another person, if you could have it tested for tick-borne illness. I'm not sure whether or not that can happen, but it wouldn't hurt to ask. Another thing that you can do is autologous blood. That means you take blood from yourself and you store it for if you need it, and then you can get that and put that back into you. Now, again, your blood probably has some spirochetes in it. It's probably not the best thing to do, but it's probably safer than getting someone else's blood. So I hope this information has been helpful to you, and I hope you have a wonderful day. Juju says bye-bye. Bye-bye, everyone.